Hi, we often get asked, Doctor, what is a good amount of screen time for my child? And during a lockdown like this, that question becomes even more pertinent. Screen time is a type of near activity. Reading a book is also a near activity, and studies have shown that increased near activity can increase the risk of myopia. Myopia is wearing minus numbered glasses. In fact, most of the people you see around you are myopic. And myopia is caused by environmental and genetic factors. Genetic factors you cannot do much about. Environmental factors are too. So if your child spends a lot of time doing near work and very less time outdoors, then the chance of developing myopia increases. What are the disadvantages of using screen? The first is it's an addictive activity and it's not a good habit for our children to have. The second is the content does not necessarily add value to your child's life. The third is using a screen does not allow a focus and concentration to develop. Fourth is when we use a screen, we blink very infrequently, and this infrequent blinking can lead to dryness. And the fifth is, of course, myopia. Now, what are the actual screen times that you should be aware of? For 0 to 2 years of age, it's almost nil. For 2 to 4, it's 1 hour a day. And for 4 to 8, it's 2 hours a day. And the way you can achieve this is firstly by casting the phone content onto the television by a Google Chromecast or an Apple AirPlay. The second is to curate the content. And the third is to break your daily quota into time slots of 15 or 20 minutes. Now, reading is a near activity, and but the advantages far outweigh the disadvantages. And one way to build a habit of reading during this lockdown is this. You tell your child to read for 10 minutes before sleeping, only 10 minutes. And this they must, there's no escaping this. And if your child is able to do this for 10 minutes every day before sleeping for a few weeks, you'll never know when the 10 minutes becomes 15, 20, and 25. And finally, after the lockdown ends, and if your child has myopia or increasing myopia, ask your doctor about atropine eye drops. Thank you and stay safe.